Homeopathy is a natural form of medicine that has been in worldwide use for over 200 years. A professional practicing this type of alternative and complementary healthcare is called a homeopath. Homeopaths have legally the same responsibilities as medical practitioners, which are to diagnose and treat patients. However, they use different treatment methods. Homeopathic treatment is based on the principle of like cures like, which is the law of similar. In other words, a substance taken in small amounts will cure the same symptoms if it were taken in large amounts. On the patient's first visit, the homeopath carries out a lengthy consultation. A typical first appointment takes approximately 1 hour. As well as exploring the illness that the patient is seeking help for, the homeopath will ask the patient about things such as diet, exercise, lifestyle, traumatic events, and childhood history. This is because the approach is holistic. It is not just about treating the symptoms, but instead looks at the whole person. Homeopaths examine the patient by taking blood pressure, listening to the lungs with a stethoscope, examining the ears, the tongue and throat, and other parts of the body depending on the condition. They will explain in detail to the patient what the diagnosis is and what the treatment should entail. Homeopathic medicines are usually made of substances derived from plants, extracts, minerals, animals, and trace elements. The medicine is prepared through a series of dilutions, at each step of which there is a vigorous agitation between solutions. Remedies are matched to the patient's symptoms, while the strength and frequency of dose is matched to the patient's need. The homeopath gives the patient instructions on how to take the medicine and will also give general advice on a healthy lifestyle. There will be follow-up appointments with some patients to assess how the treatment is working. Detailed clinical notes and records are kept for all patients. Homeopaths with a good level of professional experience may be involved with training and/or supervising of homeopathy students. They often oversee the research of students. Most homeopaths work in their own private practice. This means that they have to manage the business and all that it entails, such as finances, appointments, marketing, and promotion. If you are a person who wants to improve the health and well-being of people, you may enjoy working as a homeopath. To practice as a homeopath, you must register with the Allied Health Professions Council of South Africa after completion of your studies.